Good morning, everyone, and welcome to the Minnesota Real Estate Journal Breaking Through the Disruption webinar series. Let me just pull up a couple slides here to go through before we kickstart today's webinar. First and foremost, if many of you have been on our webinars over the last 3 months or so, this is about our 40th webinar that we have hosted as a company. And we are so pleased to be hosting this webinar here today. Today's webinar has been approved by the Minnesota Department of Commerce and the Minnesota Commissioner of Commerce for 1 hour of real estate continuing ed. If you are an attendee today and are interested in receiving that 1 hour of real estate continuing ed, we are time stamping your entrance to today's webinar, and we are time stamping you out. But as a backup, as always, we are asking you to go to the right-hand side of the screen and type your name, full name, and license number in the right-hand side of the chat room right now, and then when you exit today. And then also, we are going to have 2 polling questions that we're going to be asking today. I'll jump back online and I'll be asking those questions at random points throughout today's program. And if for some reason you happen to have any issues with your continuing ed, and if you need any questions answered, please reach out to Katie, whether it's for this webinar or any of our other previous webinars or live events that we posted. All right, and then also, if you happen to have any connection issues, number 1, at the top of your screen here, there's a red button that will say reconnect. Simply reconnect, push that button and it should reconnect you and it should solve your issues. And if you're still having issues, try a different browser. And the best browser seems to be Google Chrome. So all you have to do is just copy and paste your link over into Google Chrome and you'll get right back on. All right, and as mentioned, on the right-hand side is your chat component where you can ask questions to all the different speakers and the moderators. Feel free to reach out to them, say hi to all the other attendees, and any other questions for the presenters today. All right, in addition to today's webinar, we've recorded 40 additional previous webinars, and you can find those on our website at rejournals.com/video replay. All right, now here we go. On with today's program, Senior Housing Design for a Safer Future, COVID-19 and Beyond. Let me pull up our presenters, and I'm going to kick it off by introducing our moderator for today's webinar, Susan Farr, Vice President of New Business Development with Ebenezer. Susan, it's all yours. Take it away.
Okay, thank you. Welcome and good morning, everyone. I just wanted to mention we have a great program for you here today. And I've always said after 9/11, we never traveled the same. So today, we'll never see senior housing the same. Nothing that it's that drastic, but we have a great lineup. And I think the best way to sum it up is we are going to have to be flexible. We're going to have to be creative. We're going to have to be great at the new buildings and remodeling. And I just really think the senior living will be a combination of healthcare, hospitality, and residential, all thrown in together. And I always say we will adjust. So now I'm going to start. I'm going to introduce everyone quick. So we have Shannon Russ, and she is with Oppen, a developer. Joyce Stubneck, she is a partner and president of BDH. We have Jill, who works with me at Ebenezer, Director of Housing Development, and has built a lot of buildings. And we have Christine Soma. She is a principal and partner at Pope Architects. So Christine will be starting off.
Yeah, thanks, Susan.
Sure.
Do we have one? No, or maybe we don't have an echo. Okay, go. Not quite yet, Jeff, on the slides. We'll wait till the second. Okay, thank you. So over the past few months, many of us, especially those in the senior living industry, have faced one of the most challenging times that has occurred in this century, at least. Our country, our world, continue to find ways to adapt, thankfully. But as we learn more about the virus and more research and statistics are available, We know that this disease has a more significant impact on people with health problems and increased age. Over this time, we have held up hospital staff, EMTs, and grocery store workers as true heroes who continue to defend the front lines against the virus. And for that work, we are very, very, truly grateful. However, over the same time, I've started to gradually realize that the same reverence hasn't necessarily been given to the senior living industry. Surprisingly to me, and to the contrary, it seems that senior living communities and staff who are working very tirelessly and quite frankly lovingly to defend and protect the people who are essentially at the greatest risk in our community have honestly faced a pretty harsh public response. With support from different advocacy groups, leading age care providers, and others in the industry, this narrative has started to shift. But I just wanted to start this conversation by not only thanking the senior living providers, staff, and frontline workers for their resilience and love during this time. This is a message that I and many of my colleagues have been sharing tirelessly with our friends, husbands, wives, relatives, neighbors. But I want to take this opportunity to spread this message to a bit of a wider audience. As an architect who's worked in senior living for quite some time, I love the opportunity to think of design solutions that would limit the impact of COVID. But one of the biggest impacts we can have on the industry goes beyond that, and on the success and happiness of family members and friends living in these communities is to provide support, very far-reaching support. In addition to the basic personal protective equipment, testing that was so long, and testing that was so long denied of these communities, they are also in need of government support, community support, and the respect they deserve for continuing to put their lives at risk to care for those in our community who deserve the very safest and the very best. So we're going to continue talking about senior living development and design during COVID, but I just want to urge everyone to not only think about what we're all doing from a development perspective, but just also join the conversation to help continue to shape the public narrative around this topic for an industry of heroes. So thank you to the people on this call, especially. Jill, I think you're going to talk a little bit about operations now.
Sure. Thank you, Christine, for those great comments. It means a lot coming from somebody who's outside of the day-to-day work, and I frankly am outside of the day-to-day work. So I will just reiterate her emphasis on thanking the frontline workers that we have. People who are worried about their own life at home and staying healthy for their families, and honestly caring for residents that they worry about too, making sure that they're staying healthy. Can't say enough about that. I also want to thank my colleagues, because when this is developing, they have been building the wheels while we're driving the car. We've all written disaster plans, but I don't know that we've set unprecedented so much as we have in the last few months, because they have had to really translate those disaster plans into reality. And it's a lot different when you see it written on paper than when you live it. So many of my colleagues contributed to a lot of the feedback that we have incorporated into our design standards for infection control. So I'd like to share some of those with you, but the big topics would be making sure that we have great access to hand washing. Since it's such a simple task, but making sure that that's accessible to all, and when not available, we have more hand sanitizer. And then, of course, we all have heard the news, but translating personal protective equipment into multiple people using it multiple shifts during a day to care for residents. Within Ebenezer, we have over 4,000 residents, so that translates to a lot of PPE. And then certainly looking at our environment, what can we do to make sure we're not touching as many things as we are used to touching? I think we've all changed or been educated about how to avoid touching things that we don't have to. And then, of course, we're a social environment ultimately. We provide housing to seniors and people who thrive on connections with each other. So those are the big topics I'm going to talk about today. So we were right in the midst of this. We had a building that was in the design phase. So we were able to get that feedback, and this is a project we're doing with Oppidan, and I really thank them for their flexibility in incorporating many of our ideas into an actual design. So we've had the opportunity to see how we can make things work. So something relatively simple we did is that we have, whenever we have public areas on a floor, we do have public bathrooms, but we don't have public areas on every floor. So we simply added a couple of extra hand washing sinks into this project. We struggled with the idea of it making it look a little more institutional, but with the help of BDH, we're going to make those look attractive. So that was a relatively simple thing we could do. We certainly will still do stations for hand sanitizer also, but it's nice to have hand washing readily available. Dealing with protective equipment takes up space, so we had to make sure that we had some safe, clean, accessible storage. And unfortunately, we had to make sure that we're securing that valuable product. We saw some of the worst in some people in hoarding those things, and we want to just make sure that isn't something we deal with in the future. And unfortunately, because of all of the product that we're using, we also have to deal with the trash that it creates. So we looked at how we could make sure our trash rooms were more accessible, could deal with more trash along the way. I think Joyce will cover some of this, but we did consider what products could we use to help keep from passing on infections. So I've approached our nurse call vendor and have received a great response about the openness to making sure that the things that they touch regularly, their pendants are made of something antimicrobial. Also, as we looked at the submittals for this building, we have a number of power operators for doors, and of course, we've all gotten used to hands-free flushing, hands-free water in the sinks, hands-free soap dispensers, but we've also added hands-free power operators. With a simple wave, you can open the door. A big area for us is the people that come and go. Certainly in this time, we've limited access to our buildings. Visitors can't come right now, but we still have some essential people coming and going. Certainly our employees, but we do have vendors, we have mail delivery, and we have been screening all those people, which involves right now people coming right by our reception desk. It's frankly a popular spot normally, and now we've increased the activity there with potentially some people who could be carriers. So, and right now we've been able to procure hands-free temp sensors, but we still have them sign a log, and we have to track that paper, and we have to do something with it if they're beyond our parameters. So it still requires a lot of interaction with people. So in the project that we're doing at the Oppidan, and I can see this happening in some other projects, we have a separate entrance for deliveries. So we converted that. Luckily right now on this project, it was just making some drawings on paper, but we created the vestibule there where we could have a hands-free temp and logging device. And then we have one door that goes off into an employee locker room of sorts, and then another that allows access to the mail area of the building and delivery for the kitchen. We also happen to have a parcel room right there. And so in order to, in the event of quarantine in the future, we made that accessible for a potential visiting room. And I know Christine will share some other ideas about this in the future, but so we wanted to make sure that residents could potentially get in a room relatively close to their family, and they could have a communication back and forth. I'll return to that staff's locker room. So we built in a couple of small bathrooms with showers, and then made sure that the flow was appropriate. So again, they go past that temp screening, they get access to the locker room. They can leave their items in some lockers, and then there's bathrooms available so that they could take a shower before or after their shift, and then the time clock, and then they're able to enter the building. So that enabled us to get something, some employee sanitary place for employees before they encounter our residents and other staff. But I think most importantly, we have to pay attention to the social needs of the residents. We all have felt the stress of being more isolated from our family and friends. But certainly as you think of a senior who can't even see their adult children, grandchildren, it is a challenging time. Many of us know this personally. All of a sudden we have seniors who are Zooming. My 91-year-old dad never used a cell phone in his life. And now he's been able to have a Zoom meeting with his cousins in Norway. We didn't even try to do that before COVID. So it did open a door for us. I got him an Echo Hub and he called me 3 times in the first day. So I had to make sure and get my sisters set up quickly so I could share the wealth. So we're seeing some great things about that. But in order to enable that, you really need a strong Wi-Fi in the building for the number of devices that will be working over them. It's also very important to support the staff, because we have staff all over who are spending their time now being Zoom or FaceTime assistants. They come and bring the device to a resident who can't operate and make sure they have a meaningful visit with their families. We've also been able to capitalize on having a TV with a site, if we have a site-specific channel to broadcast announcements and programming, so at least people can participate in some organized programming, exercise that's led through the day, or a chapel service to get people involved and have something to do on a scheduled basis. We are looking at how do we get common rooms to be capable for social distancing. It's a little challenging. We understand that real estate is expensive, but if there's some way we can organize a space, or at least have a couple of spaces that could be divided. I already talked about the visiting window with a hands-free speaker. A big thing about that I should return to is that it's important to allow some confidentiality, and that it's not some place where just anyone can overhear what staff and what residents are talking about. This does certainly have an impact on our staffing pattern and how we're able to meet the needs of everyone in a very isolated way. We're doing all of our meals delivered. We are frankly monitoring, making sure that that residents who have increased needs are kept safe. People who are independent are having increased checks, which was not something that was a part of our original staffing pattern. So these are things to keep in mind as you're planning for the future. Of course, we have to support the staff who are bearing the stress. As I've started with, they're caring for our residents with a great deal of heart, and that doesn't come without knowing what the consequences could be. So, if you're working with senior housing, please do all you can to support the staff. Certainly, this is not a commercial for Ebenezer alone. This is a commercial for all of senior housing. Many senior housing providers do have a fund that, if you would reach out to your local favorite senior housing provider, they have a foundation where you can support that would encourage staff recognition, additional resident programming. People have been very creative about that. I just want to say before I'm done that certainly COVID has sparked this fire underneath us, but it has made us recognize that we should be prepared for any other type of outbreak that could happen. We certainly in the past have dealt with a norovirus and the flu throughout the years, and had to do many of these things. So many of these things I'm suggesting seem like the right thing to do regardless, even if COVID does get a vaccination. So with that, I'm really pleased to work with such fine architects and designers who are also thinking about these important topics. So if Christine wants to take the ball, thank you.
Yeah. So Jeff, can you pull that PowerPoint back up again? Is he getting it? Okay, perfect. Thank you. So thanks, Jill. That's a really good segue because, you know, as designers and architects, both Joyce and I have been talking about this with one another, that there are so many things that we can consider through this time from a design perspective. But before we even talk about the specifics of those, you know, both of us felt the importance to just point out how important and crucial it is to be strategic about these design decisions. You know, we're looking at ways to find safer environments, but we also want to make sure we're not going backwards, back to the old institutional days where we were designing under more of a healthcare model. You know, we've made a lot of progress since the 1950s and 60s, and we want to keep that momentum by designing homes and spaces that are comfortable, welcoming, and warm. So keeping that as a priority, along with Jill mentioning the need for flexibility, and also affordability. Again, two topics that are not new to us who design for seniors, but you know, we always are. I feel fortunate that we've been all designing to be nimble and flexible, and so we kind of set ourselves up for success as best we could in some of these areas of design. So the first thing I wanted to talk about is the idea of decentralizing the front door. And this is a project I'm actually currently working on where you can see we're dividing up the building into small scale areas, small scale households. We're separating them out, separating each of the households out with their own front entry, garage, and front door. And then where it's more units and apartment style, we're still dividing that space up further than you might typically see with just a single entry for the whole entire campus. So like, I don't know if you guys probably can't see my cursor, huh? The apartment style building that's sort of in the middle, there's arrows pointing to each of those entry doors, where typically you would maybe only have one entry at that location. And what that does, having those decentralized front doors, is allows for less overlap for people crossing through a campus where typically, you know, people would be going through corridors and sort of seeing lots of people. So this allows for that reduction of crossover throughout the campus. And especially, I mean, even if you are still committed to wanting one single front door for wayfinding, those separated entry doors can be used for residents and staff safety. And it really brings down the scale of the building as well to a more human scale, which is not necessarily a COVID related thing, but it's just a good design for senior living and residential scale. Okay, you can go to the next one. Is that possible? There, thank you. So then as you dig into this a little bit further, just looking at how those households can be created in such a way to, again, keep people separated but allow for small scale spaces to occur. You know, we're at the point, thankfully, where people are starting to slowly and safely test coming out of their room. It might be in shifts, it might be in small portions, but being able to create small spaces in a memory care. You know, we're even seeing this sometimes in assisted living, people going more of the household model. And so creating areas for people to have those small scale gatherings and still be safe. So you can go to the next one. And then within that space, you know, thinking about how the area is laid out. Here, we would have this area on the top is actually the dining room previously. But we're finding that we need to separate out spaces and separate furniture so that the tables and the chairs don't come close enough to each other to for people to be at risk of not being socially distant. So having, you know, nice wide spacing between chairs of the tables are 7 feet wide, and have the chairs spaced 6 feet apart. And then adding tables maybe in this living area or the hearth room where you typically wouldn't have people dining. Now we're just being a little more creative and spacing those out so that people can maybe meet in small groups, but still stay safely away from one another. You can go to the next one.
Yeah, I can jump in here, Christine. So all good points that you made. And as Christine and I were working through what to present to you today, we wanted to make sure that we showed options. I think the really important thing that we keep reiterating is flexibility, but also that not all campuses, not all buildings are going to operate the same. So this is a good example. This is actually the project that Jill was mentioning that is in design, and we made some changes. We did look at this to determine if we needed to make some sweeping changes to the dining room. And actually the way that the plan had been working out with structural and some other things created some natural separation to the dining room, which worked to our advantage. But the message that I wanted to convey here is you can see that we haven't changed the furniture. We've definitely given the spacing. But this can be another approach where we've created some more natural separation. You know, certainly if we needed to, we could add some doors, we could add more barriers. But our choice was to have that separation, make sure we had proper spacing, and then utilize flexibility. So not changing the furniture, but utilizing operational tactics such as only having households dine together or dining in shifts. And then there's other places within this building, as Christine was showing in the other plan, this is a very similar scenario. Other places, a community room, a pub, where we could use those as dining spaces as well.
All right, I'm going to jump in real quick, just so you know. I'm going to ask our first CE question of the day. So if you need real estate CE, now's the time to get ready to answer it in the right-hand side here. So here we go. And this webinar is very timely on this, but for information as you are sitting today, would you feel safe, not safe, or need more information in order to have a relative of yours or a family member into a senior housing facility? So do you feel safe today with the information you know, not safe, or need more information? So please answer it off to the right-hand side. All right, take it away.
Great, thanks, Jeff. So again, just back to the conversation about dining, wanted to mention that to Christine's point, a lot of times it's not feasible to greatly increase the square footage. So that's why we looked at this option. We would have had to have tripled the size of this dining room to let everyone sit in it with that 7-foot spacing, 6-foot spacing. So again, trying to be flexible, trying to be adaptable, trying to pair resident health and safety with what's feasible from a budget standpoint. Jeff, if you wouldn't mind going to the next slide, please. Christine, why don't you go through this?
Yeah, so again, as we're getting into more of the unit scale, or sort of going from big to small scale, another thing we've been thinking about is each of the private units or the rooms. I'm sure all of us in this group, at least, have been on board with private rooms in higher acuity settings pretty much forever. But there are still plenty of places in the world that have double rooms. So just to start, we're all hoping that this is one of the first phases of many to kind of continue to go to private rooms and higher acuity. But even across the continuum of care, again, thinking about, what can we do for today and for the future, thinking about designing for these units. So, looking at the idea of providing an area, a zone in a unit that could be considered sort of like an ante-room, a space probably more relevant for staff, where staff can come in and kind of prepare themselves to go in should someone, heaven forbid, become sick, and then come out and again prepare themselves to go back into the rest of the community. That's the idea of creating this anteroom. There are plenty of details I could get into, but that's not exactly it might be a little too far into the weeds. But if you could go to the next slide. One thing we are doing on a project I'm working on, we're not going full on board into providing these, what we're calling sort of 2 isolation rooms in one area, but we are preparing them to become an isolation room should the need arise. And what the main thing we're doing to accommodate for that is looking at the mechanical system within each unit. Again, we can't be significantly increasing the cost. So what we're doing is looking at the system we have and providing additional exhaust and ventilation. And then also what we're doing is providing additional damper switches to switch from energy recovery into not using energy recovery. And that would only be switched if the need were to arise. That is a little bit of an additional cost, but doesn't completely change the whole system. And then also, because we would be in this situation, we would be getting rid of what we're calling it's a heat wheel. As part of that process, of the energy recovery process, additional cooling will be needed for these 2 rooms we're choosing to design that way. But again, it's small, like the small scale changes to prepare for the future. And one other thing we're doing in these 2 units out of the 100 or 70 we're doing is we're adding just a little bit of square footage on the width of the unit so that a door can be added. We're not putting the door in, but we're creating areas for the door to be added in the future should the need arise. So like Jill said, norovirus, the flu, just thinking about what the next thing that might come and being prepared for it, I think is the idea here. Okay, and you can go to the next one.
Yeah, so here is the example that in plan form for a visual aid. Bill had reviewed this and given you some information, but just wanted to show what this actually looks like. So this is the staff screening room that Jill was describing, and the intent, the need for this is, as Jill was mentioning, is just to control the people coming into the building and making sure they're screened before they come in with residents. So as Bill mentioned, that serves that purpose. Staff can be screened here. There's enough room for people to queue up. There's enough room for vendors to queue and have their house screened. And then in speaking towards the staff and them truly being frontline workers, we wanted to be respectful and considerate to their needs as well, and allow them a place where, as we said, they could shower before entering or leaving the building so they weren't concerned about bringing something home to their family. Go ahead, Jeff, and you can get to the next one for us. Thanks.
Sure, I'll talk about this one to start with, I guess. So then in terms of, so those examples were all related to things we're doing in current buildings we're already designing and working on. And then we also wanted to think a little bit about some of the retrofits, or maybe I'll call them resident hacks, that people are using. The idea of creating opportunities for people to visit their families. We know that is one of the biggest things on people's minds as we're starting to transition back. How can people visit their loved ones safely? And so in this example, we're actually looking at creating a resident visiting area. This is actually, again, one of those small scale areas where each, we had a few resident size garages like you would have in your house. It's about that size. And people can come in, families or friends can come into the garage. And we created a little resident viewing area in an old storage room, and thinking about how we would add glass, a phone. The garage would need negative pressure just to keep all of the ventilation going away from the building. And then providing sanitizer stations for residents and staff as they're helping out with that. And so you can go to the next one. So this is actually a little bit different example, but similar, where they did start creating, that little, they call them a chatterbox with the full height windows, the cleanable surfaces, and you can go to the next one. And this is a picture of a family member talking to her husband through the window. And, even though it's probably not what we would have done the first time if we were building new, just being able to have that connection. And you can see they put hand sanitizer, a flower, and Kleenex, because I think it's been quite an emotional time for some families seeing their loved one for the first time. So yeah, they're thinking of ways to kind of be creative and flexible. So you go to the next one. Okay, so.
Yeah, so that's a good point, Christine, and to talk about that. This is a little bit of a fun picture, but we wanted to make sure as we're speaking to all this, we mentioned the longevity, that the question has arisen quite a bit that, well, once there's a vaccine for COVID, we don't need any of these things, right? Well, no, that's not necessarily true. I agree that COVID has been the catalyst for us to rethink a lot of things. We've always felt with C. diff and norovirus and the stomach flu and the influenza, all these different things. But COVID has caused us to understand the gravity, really, truly, of the situation and to take these measures to protect the residents in an even better way. But as we do that, and as we think about the peaks and valleys of these different diseases, that sometimes we'll have to be more adamant about things than others. That's why we keep advocating flexibility. But while we think about all these design changes, we don't want to lose sight of the quality of life for residents. So I just wanted to say, Christine made this point as well, and I think Jill did as earlier in the conversation. I assure you that we are not going to lose the warmth, the residential feeling. Talking about having screening rooms and having PPE equipment storage and having hand sinks visible, perhaps gets us thinking about, the stigma of senior living that we've all worked so hard to change. But I just want to say loud and clear that I 100% assure you that if we all put our brains together and work hard, we're not going to lose the quality of life for residents, and we're not going to lose the warmth and the residential qualities that we've worked so hard to build. And it goes even further than that. I think this is a great picture because the outdoor space has now become such a large factor in senior living with these circumstances. And, we've seen this picture and we've seen ones of where all the residents are out on their balconies so that people can do fun things like this. Take that into consideration. It's outdoor space, walking gardens, balconies, community plantings, all those things now. They were important before. Again, quality of life. It was important for residents to have that connection to nature, but now it's taken on a whole other meaning to think that if we go through these peaks and valleys and we hit a peak where everyone has to isolate themselves again or quarantine in their units, that those outdoor spaces, I don't care. I think even in December or March, if it's still cold out, we would still be so grateful. And the residents would be so grateful to have some outdoor spaces where they could at least do something even for a short period of time. So with that, I think we only have maybe one other point to talk about from a design standpoint, and that would be high-touch surfaces. And then I think Shannon's going to give us some other thoughts from the development perspective and the state of the industry. But just to close this discussion about changes we can make from a design standpoint, we wanted to make sure that we presented you with some options for high-touch surfaces. So Jill mentioned the no-touch option, which is a very good option. So making sure we have touchless faucets, flushers, paper towel dispensers, door openers, all those things are extremely important. And I think they were extremely important even before this began. So again, if this is the catalyst that gets us there, I think it's a good thing. But some things that you might not be familiar with, the first thing I wanted to talk about was copper. I don't think that that's something that everyone is familiar with, but copper is a natural antimicrobial that kills things such as viruses and bacteria. It kills it on contact. That is a product that now is being found in door handles. Well, not a product, it's a natural metal. It's being found in door handles, in faucets, in grab bars. Again, there's a lot of resources out there that we can install that in our buildings to help safeguard residents and have that natural ability as an antimicrobial. It's also found in some side guest seating and some task seating. So that's a great option at the nurses' stations because, again, anything that they have on them from a virus bacteria standpoint, it's going to help mitigate that and just dissipate it right away. Then the other thing that I think is a fantastic product is Boon Pro has handrail for use in our corridors that actually have chemical makeup to them. They have bonded to the chemical makeup of the plastic, again, an antimicrobial. So the advantages of that is it won't wear off, it won't wash off. So those are two things that, again, those are the really high touch areas, door handles, grab bars, handrails in the corridors, where we have options. The InPro, it's really not any more expensive than any of their other products. And that just gives the operations and gives the residents a leg up on transmitting viruses or bacteria via touch. Now, I do want to just say that doesn't mean you don't need to clean these products. You still have to use the recommended disinfectants and clean them regularly. But, Jill made a comment that they had to up their cleaning in such a drastic measure that it was really eating up staff resources. So it definitely helps on that front. And with that, I will turn it over to Shannon so she can share some of her thoughts.
Great, thank you. So I am going to take a little different approach on this. The state of the senior housing industry is from a developer's perspective. But I think what's interesting is on Jeff's query of would you be safe, feel safe or not safe? I think there were only a couple that said they were not feeling safe. So I think that'll be, you'll see some of the supporting of what I'm going to talk about next. So as we talk about the seniors housing industry, there's no question that the real estate industry has experienced a disruption. As all of us moved to follow the stay-at-home order, that I think many of us thought we were just going home to work for a couple of weeks, it caused a lot of us to pause. And then we quickly figured out we need to understand this virtual environment. So as we all settled into the new environment, I think, what we quickly realized here at Oppen and many of our development partners out there in the industry realized that, any project that was good going into COVID, call it March 16th before, are still good projects. I'm not speaking to any of the other asset classes that have, their own measurement, but we have not paused on any of our senior projects. And in fact, with our operators, we're really, really very bullish on the need and demand for seniors. And I'll talk about that in a little bit. We went into COVID, call that March 16th, with 6 projects on the books, 4 in Minnesota, 2 in California. And as we sit here today, and I'm going to call us coming out of COVID, who knows, we have 8 projects on the boards. They're all in different stages. We're starting construction on one in 30 days. We've got another one in California that will be starting construction on first quarter. Many are in different stages of entitlement, but they're all going. I think an interesting aspect, timing is, I guess a lot of times people say timing is everything, and timing is sometimes very interesting. We opened our largest project. Many of you are probably aware of that, down at the University of Minnesota, Prospect Park, 282 apartments with 100 and some daycare on the first floor about 2 weeks ago. There was a whole new plan on how that opening looked, but it's gone very well. The seniors of all those that were signed up have kept their leases and have moved in. Should know exactly how many have moved in, but we're upwards of 20, gonna have 40 maybe within the first 30 days or so. So it's going well. They're happy. It's actually been, a joyful experience. The daycare, all the kids, I think we've got about 85 kids that are going to be coming into the daycare. So we'll look back on this and really always say, wow, that timing was something else. But with a good operator and good plans and good intentions, which we all have, it's been very successful. We're also opening what would be then our second largest community in Napa, California, in the next 45 days. Same story there. We're making adaptations to how that move-in is going to look. A lot of special equipment and managing virtual tours. And Jeff, I think you need to do something.
Yes. Everybody hear me? All right. So here's my next question, CE question. So everybody's going to love this one. So do you love Shannon's office? Simply answer on the right-hand side. Yes, Skol Vikings. No, go Pack Go. Or I have another team I'm a big fan of. Answer it on the right-hand side. It's back to you, Shannon.
So a little bit, the seniors housing industry, it's, from our perspective, it's go. Nothing has changed from our seat. And I'll talk a little more about that. The financing environment, which I get a lot of questions on that. The fact of the matter is the capital, both equity and the debt financing, that was available prior to COVID. This is only March 16th, and I know it feels like it's, we've been in this forever. It's still available today. And in fact, there might be more capital for some projects in either our asset class or other asset classes that are not occurring. And we all know it needs to be put to work with good projects. So is there more scrutiny today? Yes. And there should be, as always. We learned this from the 2009 recession. So, we developers, it's like we forget, the hard times we try to forget them. And I think, there may be some bad habits coming in again. So I think we're in good shape. During this period of time, literally, we've lined up financing for our 120 unit community that's happening in Grand Rapids. And this, all of the equity and financing was done within this virtual stay-at-home period of time. We're lining up our partners. We're choosing a partner for a $100 million project in Southern California. The money that was available going in and your partners, they're still committed to working with good projects. So this asset class, seniors housing, is a very focused still today as a good segment within the real estate industry. And then someone else asked a question on what's it been like? Because we're working on four to five projects that we're working through the entitlement process. How's that gone? I would say it's gone really well, because many of us developers, all you developers out there can feel my pain or understand, it's hard getting a hold of city and county employees, sometimes trying to get your projects through planning and zoning and understanding what the challenges are. They're busy. They're busy when they're in their office because there's a lot of things going on from working in city environments. I feel like that has all come full circle. In fact, some ways it's been a better experience. From I think many of you developers out there would probably agree, as it relates to money and attention to the facts. Really, we're paying attention to the facts that matter. The community members, the city officials are focused on what matters, and we're not spending a lot of time on inane details that get us snagged up and cost more money, more time. I think it's, and we'll talk a lot about these, and I've talked a lot about these, the silver linings to COVID. I think all of us are more focused on what matters today, not just professionally, but personally. And I see that coming through in what I'm doing on a day-to-day basis. When we got our Hermantown project was approved with a city council meeting virtually in early April. It went great. We're doing the same thing with the project in Lakeville. We had our neighborhood meeting virtually. Our two California projects that are pretty significant, one's Northern California, one's Southern California. When this first started, our next step in our Northern California one was to have a neighborhood meeting. And this is in Santa Cruz, California. If any of you are familiar with this community, they are a very savvy, protecting their butterfly habitats. I mean, it's like, it's important. The neighbors are very important. We were able to hold our neighborhood meeting virtually. We had 60 very organized, savvy, question full. We got everything handled, got everything posted to the website. We moved on. So we're going in to make our entitlement submittal. We'd still be sitting here waiting till we could get to Santa Cruz to meet with those neighbors. And it still would not be happening today, and we'll be submitting. And same thing with our Southern California project. What I would say on that one, we're further along, we're entitled. We needed to get out to the general contractor, get our DDs done, which we did virtually with our designers and engineers. Got the DD set out to our DD set out to our highly qualified general contractors out there. What I loved seeing and hearing is every one of them said they're getting fantastic coverage from the subs, as opposed to 4 to 6 months ago. What I couldn't get them to commit to was their cost savings. I look at it from a developer's perspective. We had that period of time where subs are walking off site, going across the street for another $1 an hour. I love that we're going to be able to choose and have some high quality subs and high quality projects. So to me, all very good news. I mean, we're super bullish on everything. I think it was Susan that wanted me to close with the question, should you develop now or wait? And as we're all in a lot of these industry seniors housing discussions, that comes up a lot. Going back to some of the things I said, we went into COVID with 6 projects. We're now actively, working on 8, not just working, we're going to do these projects. We made a pretty bold decision 1 week into COVID, into the stay at home, to not break pace on our projects that we felt positive on right there. At that time, it seemed, a little risky, but we went for it. We had no idea. We thought this was a 2-week stop. We had no idea that we were going to be, working from home for nearly 3 months. But because of that decision early on, and that's understanding where the senior demand is, we feel that we're months ahead of those that paused, or if we had paused. So we love the idea that we're getting good coverage on our contractor proposals, and we're taking a couple more out to bid, so we'll be able to, I can report back to see if we're seeing the same thing. The good news is we want to participate in this opportunity. If our general contractors are getting good coverage, we want to be part of that. We all know the pipelines are going to fill again. So we always do. So here, there's a window here. I don't know how long I can't tell you how long it's going to last, but it's here. So in summary, overall, the demand is still here. Same demand that was here March 16th is here today. I like hearing from most of you that you would say you feel safe. And for those of you that don't, I understand. I mean, that's not a criticism. It's, it's been scary. So the demand is there. It's going to be there for the next 30 years. If you understand the statistics and the demand, and we've done all kinds of studies, this is here to stay. As always, you need to do your due diligence up front on your projects. Make sure the site is good. Make sure you don't do 1 market study, do 2, do 3, whatever it takes. Make sure the demand supports the project. Make sure your costs can support the rent to that particular market. Any project, I would say, if you think of what has changed, if they were questionable with lower returns going into this COVID environment, they're probably not going to move forward, because we're making some changes even to our projects on the boards today and the projects that we're operating and owning right now. And we've got impacts that everybody before me spoke about that will increase construction costs, and then we're going to impact our operating expenses. These are all very important. We need, if you don't have a heart for safety and caring for seniors, you shouldn't be in this business. But you got to make sure that we've accounted for all these COVID items, whether, like we'll say, if it goes away, we'll figure out a way to convert these uses. Probably most of them are good things that we should have done anyway. The equipment, the design, employees, filters, so on and so forth. So my answer is yes, stay the course. The demand is there. I can guarantee you that. The office workers may not return. I don't know. Shoppers may not return to the malls. I don't know, but the seniors are here, and they're growing every year. And we are personally committed. Everybody here that spoke to you today, we feel honored to be working with such an incredible group of operators, architects, designers that really care. We're here to serve the seniors safely, and we have to do it intelligently, and we can only do that as a team. So go Vikings, go seniors housing.
Okay, do you want me to do the closing remarks? Everyone mentioned most everything. Like Shannon said, the next 30 years, you have seniors coming on like a freight train. This is, they're there, the population's there. no matter which way you look at it, we have to keep them safe and we have to figure out what to do. I think you're going to find out after this COVID-19 who was ready, who had equipment, who had policies, who had backup. I think you're going to find out real quick which operators were ready and which were not. We're in it for the long term. Ebenezer is, and we just want people to be safe. And the other thing is, now we don't have all the data. Once we do, trust me, we will be looking at it with the fine-tooth comb. What we have found so far is people that have gotten COVID-19 in a senior building or COVID-19 in their home, they have recuperated much better in the building versus the home. They don't have the RN, they don't have the personal protective equipment, their family couldn't get it, their family's fearful of going in there and getting COVID-19. And so unfortunately, the results of people at home, isolated, dehydrated, etc., have not fared as well as if they were in a building with the full-time RN and all the equipment. We were nimble, we adjusted. Ebenezer, one of the things we did immediately was we had a gentleman, but all he does is he is with the PPE, protective equipment. All he does 8 hours a day, gowns, gloves, masks, shields. So we were really excited to have Brian on board with us because it's just another advantage that we had over others. So we had the equipment and we were ready, and we just want everyone to be safe. So with that, I will close, and we're very excited that you all tuned in, 160 people. Thank you.
All right. Well, thank you again, everyone. Just want to give everybody a quick little update. I put 2 polling questions out there. I'm not sure if everybody saw this, but my first question was, are you working from home? 40% of the people said yes. 33% people said no. And excuse me, are you working back in the office? I had that question backwards. 40% of the people are back in the office. 33% are still working from home, and 25% plan to be back in the office in the next few weeks. And then my last question was, if this event was a live event over at Golden Valley Country Club or somewhere else, 31% said yes, they would be at the event. 19% said no. And 49% said give it a month or so and see where we're at. So let's end it with this. With this webinar and all of our other webinars, you can find on our video replay at rejournals.com /video replay. And then our next webinar coming up is COVID-19 business interruption insurance and strategies. And here's a few upcoming webinars for any last minute CE that you might need. We have a webinar tomorrow on the 17th, one on the 18th, and one on the 19th. In order to find information about those webinars, go to rejournals.com /webinars. Once again, thank you to all of our speakers for being involved with today's webinar, and thank you for everyone attending. I will keep the chat room open for a few minutes, so please make sure if you need the real estate CE credits, please sign out on the right-hand side in your chat room. And thank you so much for attending today. Thank you.
Thank you.
Thank you. Thank you, everyone. So when he says he's leaving the chat room open, is that in case anyone has questions that wants to stay on?
Correct.
Okay, that's what I thought.
I see Jill Schroeder has a couple of questions.
Mhm.
So if Jill or anyone else is interested, she had a question about incidents of death versus in congregate versus public spread, I'll say. So certainly it's a high number of the 1,300 deaths. 1,000 are in some congregate setting. Now, it doesn't differentiate between assisted living or skilled. And then without quoting a lot more stats, they're certainly all on the Department of Health website. And then the other question is, should we be having double rooms in skilled care? And I'm not in charge of this decision, but I would say we've certainly learned that is not wise.
Correct. We
She
should
had
not be
another
having-
question too. So I can't see Jill's other question, but I know she had one. So.
I think it was something about doors. I apologize. I read it and
Oops.
I think there were a couple questions as well about, like, for instance, what Christine showed with the unit. Could that be modular, that second entry, so that it can be removed and put back in? And yes, certainly, you know, a good option that we don't explore a lot in the residential side with senior housing is demountable walls like dirt or Inscape. And those offer you a lot of multifunctional possibilities to take down, move, put back up.
All right.
All right, anything else? Otherwise, we'll sign off.
Oh, good job, everybody.
All right, thank you again for everybody.
thank
for
you.
being
Thank you,
involved.
everyone.
Thanks for
Awesome
being
job.
Thank you.
Have a good
Bye-bye.
afternoon. Bye.
Bye-bye.